Namaskar. Good evening. Today is Doctor's Day. It is celebrated in India by the Indian Medical Association as Doctor's Day to commemorate the dedications or the contribution of Dr. Bidhan Chandra Roy, the then Chief Minister of West Bengal, as an eminent physician to the healthcare system. If you observe this, all over India it is celebrated. But healthcare, it is the responsibility of the self-care by the individual itself. Though the care is given by the medical personnel, paramedicals, and all supportive healthcare facilities to upkeep of a good health, but the responsibility lies in the individual itself. And it is just, we have celebrated recently this Yoga Day. The yoga is now told, it's not that only physical exercise, but it is a total awareness regarding the living facilities. So the most important factor, the awareness have the key roles for maintenance of good health, as it is been defined in the WHO. It is a state of completely physical, mental and social well-being, not merely the absence of disease or infirmity. If your health is good, then your mind will be good. A healthy body will give you a healthy mind, and healthy mind give you healthy thinking. And these all three things depend on your lifestyles, means your way of activities, your way of employment, and your day-to-day activities, what you are going to strive, and this will lead you how the awareness drive, and which will help you how to yourself be cautious for maintaining a good health. Definitely, this COVID infection, as known as the COVID-19, in the December it was 19 December it was found from one country, and it was have the peculiar spread. An entire world suffered the COVID infections. It is different to any other viral infections. That's why sometimes it behaved like a rudderless ship and started with a slight common cold, slight cough, sometimes asymptomatic, but causing more harm inside. Suddenly they are so aggressive to cause respiratory distress, the acute respiratory distress syndrome, and the saturation of oxygen was suddenly down. That's why at that stage everybody, each and every patient, they required oxygenations, for which oxygen cylinders, oxygen concentrators, and it was BPAP, CPAP, these machines were required where to just maintain the airways. And these type of respiratory infections was also never seen before, and it was a very acute epidemic state. Because of its rapid growth, that required not only the medical support, the other supporting forces were required to meet the complications. Somebody, due to the respiratory distress, if their blood count comes low, so they require blood donations. If somebody has got cardiac problems, they wanted the emergency cardiac care. That's why all other paramedics were required even if for a particular disease, though not required at a time, but they were required by the individual to save life. That's why it is known as the more, it became, the economy was, the expenditure was more, lot. If for normal viral fever, if it has to spend suppose 1,000 rupees, here it requires even 10,000 rupees, means 10 times it was required. In that ratio, the economy was required because to only maintain and get rid of the viral infections, this COVID-19. A stage came when all positive cases were isolations, and it was decided isolation is the only treatment. But later on, it was seen, even in isolation also, they told, let us isolate at home, because the hospital expenditure to the patients were more. Rather, the attendants were not able to go unattended. So they were isolated at home, and home care was given by the medical and paramedical people. That's why the economy was a little beyond limit. Then the whole country is, it is just like a tornado, cyclone, or any type of hazards, cyclonic hazards. This, it came like this, so that immediate assistance was warranted to at least save the life of the people. That's why the economy was uncontrollable. It has not only happened in India, in all over the world. In comparison, India has very efficiently made up the requirements. Even many voluntary organizations, they came forward, like the Gurudwaras, other NGOs, they all helped, like any other hazards coming to the rescue. But these type of things, it was beyond expectations. Whenever a normal patient, even I told you that viral fever, any case in emergency, acute emergency comes to the hospital, that was only 10% emergencies. Here all 100% emergencies is there. Everybody required fast oxygen, first survival, then you go for the management of complications. That's why it became a crisis problem. And everybody, even one can donate blood, but one cannot create oxygens. So that's why oxygen cylinders, oxygen concentrators, oxygen things were supplied to the, when immediately they are requiring to this infrastructure was not initially built up, or our country was not ready for that. Now, first episode, second attack, now in the third attack we are 100% efficient in medical colleges, starting from the all primary health centers to even medical tertiary care, health care. Everybody is now potent to manage any type of emergencies, including COVID and also other viral infections and pandemics. It's a fact that the requirement of doctors in our country for 1.4 billion populations, it was not proportionately there in our country in these areas. Now, even we had in one country, in our nation, we had only one AIMS, that is in Delhi, national capital. Facilities were existing only in metro cities or very big cities. But now you find it is gradually expanding. More than 5 to 6 AIMS are there. New medical college, government medical college and private medical college are also been established. And seats in the colleges have been increased. medical curriculum is also now has been regulated to most important is, even if this personal care as a family physician or family doctor, so people have to gain faith for that. Now, as you told, the people are now taking it as industry business type. But actually, necessity is the mother of inventions. Now, in the entire serving people or employed organizations, employed people, they are aware of their own health. So they are so committed in other field other than medical field. They want to save time, get the things done, and actually their awareness is leading to at least for a regular checkup. So either it is requirement or not requirement, they are at that stage unable to decide it. But actually, if it is done, then it is a facility created, or people think they're on the door-to-door campaign type medicine services, supplying medicine supply chain, or giving this lab facilities at home services. So here they are getting health checkup, and as well as they are employed without hampering their own duties. And this thing now to the grassroots level, starting from the bigger city to the rural areas, if it goes, the entire populations will be made healthy. Otherwise, the common parasitic infections, what are happening in the rural areas, like roundworm infection, hookworm infections, that been controlled. Even so many states, they are giving some health insurance scheme, bima, abhi kari rahe. Even using normal safe delivery, they are using this thing, the awareness drive to the end. Safe delivery, they are giving also registrations, nobody do, even everything has been now. It is so nice of that, because of the more awareness program, the paramedics, even this entire society is so aware of health, they thought it is the only thing, Arogya Sukha Sampada. Health is actually wealth. That is why, even if we feel that we have been exploited by these paramedical taking this business drive, but at the same time we are satisfied, the population are satisfied that they are actually getting more out of their own investment. As far as the doctors joining army, we have about one medical college, that is Armed Forces Medical College, Pune. And they are holding that entrance test. Those who qualify, they have got around 150 to 200 students per year they are taking. So they come out there as commissioned officers. But besides that, those who are passing from civil medical colleges, if they are desirous of joining army, the upper age limit is of 30 years. And people prefer to join as a permanent commission or short service commissions. When they are short service commission, they test and they feel well, and then they even change for the permanent commissions. Otherwise, they leave army and go away and practice or join in the civil services also, in the civil medical colleges or civil area as a private practitioners. I have practiced in civil as well as also during my service career in army. Civil practice, actually, as a doctor, no disease is civil or army. Diseases are same, but it differs the situational things, where the patients in the army are little disciplined, anusasite. Whatever you advise, they sincerely follow it, because they say that the system has, because they have got faith in the system of medical care in the army. In civil, actually, as you have already mentioned earlier, people think that we have been unnecessarily exposed to the extravagant expenditures. That is actually, otherwise if you have got faith in a doctor, plain water can cure disease. In civil, to create that faith to the own patients, little tricky. And some people are successful practitioners. Even they love practicing than joining the services. And they are successful practitioners also. That's why this will be my thing, because we have been suggesting to the government as many times, even if wherever you serve, let them give in a chance, everybody, to at least 5 years service in the army, to have a disciplined life, and the way of teaching, way of behavior, way of your approach to a patient, it will differ definitely, automatically channelized, and whole country also needs that. Every medical officer's career, he may not have a chance to attend a war. Luckily, I was, during my posting to J&K, I had seen the Kargil operations that was named as Operation Vijay. And following that also, after the parliament attack, there was a Operation Parakram. Both the things I have attended, but my experience, thrilling experience during Kargil operation, the casualties were very more. And even the casualties were so raw in the service hospitals, starting from the border to the Army Hospital Delhi and Base Hospital Delhi. Even the ex-servicemen that felt that they have been neglected getting the proper treatment in the hospitals. That's why the then Prime Minister Vajpayee, Atal Bihari Vajpayee ji, he asked this service people and also the ex-servicemen the solution, and then this Ex-Servicemen Contributory Health Scheme was created after following Operation Parakram. In 2002 December, Ex-Servicemen Contributory Health Scheme was created exclusively for the ex-servicemen, and the facility was also extended to them in the service hospitals. So they were very lucky. Until that time, since I think 2003 till today, the ex-servicemen are getting treatment from the ECHS, and I was also in 2008 to 10, I was Director Medical ECHS in Central Organization, Delhi. On the Doctor's Day, I want to just highlight the development of our ECHS, जो chronologically विवर्तनवाद हुआ, though it started in 2003 and completing 20 years of its service. Initially, we had 226 polyclinics. Later on, and another 199 polyclinics were added. So it became 426 polyclinics all over India, starting from the metro cities to the village areas. People used to earlier run for polyclinic care from a distance areas, but whereas now the creation of this total 426 polyclinic, now it is very approachable, and also instead of 13 regional centers initially, now 30 regional centers are there. And you will be astonished to know every year, just tentatively, when 60,000 people retire, which includes officers, JCOs and other ranks, and if only there will be 3 beneficiaries for one retired person, so 60,000 into 3, the 1.8 lakhs beneficiary increased. So today, if you find there are around 52 lakhs beneficiaries, and a card is given, everybody is now renewed up to 64 KB card. Initially it was 16 KB, then 32 KB. Now the 64 KB card is being given to everybody, just because to record the health status and the domiciliary equipments which is given to the patients are the home use, like CPAP, BPAP machine, oxygen concentrators, and even for use of spectacles, they are getting some allowances, which is also claimed from the ECHS sources. So there is so much of development now. Even above 75 years of age, the patient need not go to the polyclinics for referral. They directly go to the hospital, and the hospital has got that biometric, and they take the patient immediately as an emergency. Even for the OPD services also, that facility is given who are super senior citizens above 75 years of age. Facilities near about more than 3,500 hospitals, laboratory, diagnostics labs. In the nuclear medicine also, they have been empaneled pan-India. So the growth of beneficiaries, at the same time also growth of empaneled facilities, people who are getting qualitative, comprehensive medical care. Recently also, the PMO has introduced the Ayush services, Ayurvedic, homeopathy, yoga. Ayush people are being also, or homeopathists also posted in the polyclinics. In few polyclinics, wherever it is available. So now people have got option. Initially it was not there. They can choose allopathy, they can choose homeopathy, they can choose Ayurvedic. But most probably the emergency health care is being taken over by the allopathy only, and which is even people are allowed to 3 stents permissible for cardiac blocks, arterial blocks, 2 drug-eluting stents, TDES, and 1 metal stents. So many things, even 6-7 lakhs worth of a brain implant is also given by these ECHS organizations. Overall, all sorts of every treatment what is there in CGHS has been provided to ECHS, and the things which are not even CGHS, which are not available in AIMS, the actual cost is given after treatment in any hospital, empaneled or non-empaneled, on special approval, and it is also claimed from the organizations. So it is a great boon for the ex-servicemen to get this ECHS, and it has developed and also still in developing state. Though 20 years has passed, again the things is in the Ministry of Minister of Defense, that is Department of Ex-Servicemen Welfare, ESW. They are still trying to accommodate more user-friendly, so that the elderly people need not run around, even to give domiciliary health care at home. This is in the process. Thank you very much for your patient listening, and wish you happy Doctors' Day again. Shubhratri.